Go.
I mean, dangers are lurking in the ocean, straight up going halvesies, and you know what I always say, don't pull it out. Today, we're back breaking down and reacting to all of the fiery medical scenes and super wild injuries from the boys. Let's dive right in. What? No. It is everybody's worst nightmare. It's actually probably caused bowel perforation, lacerations to the walls of the colon, as well as injury to the anus, which is the outer part. On top of that, you have now a rectal prolapse because as he pulled out this creature, intestines came out on top of everything else. Would you die from this? No. Would you require surgery for this? Yes. Usually a rectal prolapse is only a small amount of tissue, less than the size of your hand, and you can push it back pretty easily. But here you see a significant amount of intestines come out, and it might have been ruptured as well or cut. We hear the noise, not a big movement, but we're made to assume this was a crushed airway or an injury to the cervical spot. The concern of injuring the airway is that you can't get oxygen in, obviously. I haven't seen any exploding patients like this. Typically, you would probably see this if there was some sort of bad traumatic injuries when people get hit by cars. Things I think about immediately is, uh-oh, I hope this person did not have any bloodborne pathogens. It's hit into your mucous membranes. If you have any cuts on your skin, it's absorbed into your tissues. That's why at the hospital, we use PPE.
Soldier boy.
Oh my gosh.
Go. Go.
I mean, they did a very good job of showing us just tissue and intestines, but it does make our bodies inadvertently as just filled with a bloody fluid that the tissue totally just goes away. Where are all the bones? Bones are missing.
No. No. What you do to me?
Whoa, interesting.
Interesting.
Been hemisected, destroyed lower body, still alive because he still has some of his blood volume in his body, and you see all the intestines. So your abdomen is just a mashup of your intestines, your omentum, blood vessels, muscles in the back and the front, pancreas, stomach, kidneys, liver, spleen.
Balls off and stuff them down your throat. That'd be like trying to shove 2 grapefruits through a garden hose.
Oh! This is most likely a tib-fib fracture, mid-shaft. The tibia and the fibula snapped manually. A lot of times they're spiral fractures. The fibula is a smaller bone on the outside. It's simple to fix, but when the tibia is injured, it's not only like plates, but most likely rods, so it gives it more support down the middle. Wow. Crushing somebody's head with your foot, very hard to do. A lot of times when people try to kick or hurt somebody, cause a laceration or maybe a fracture, but not massive destruction like this. This would not show up to the emergency department. What the? I don't know what I just saw. Stop it. Who wrote this show? Massive scrotum. Testicles are very sensitive. The scrotal tissue is very thin. An axe to your back is definitely survivable, especially that it wasn't that deep, but it can fracture your ribs, it can hit the spinal cord, or it can just hit the bones around the spinal cord, hitting the spinous processes or any of the other supporting structures around the spinal cord.
What is taking you so long?
Strangulation injury causing maybe more force on the trachea than you are on the blood vessels going up and down into your brain, decreasing air, decreasing oxygen into your lungs, plus you're panicking, so you're using more energy. Ooh, blade right into the submandibular area, into your airway. If you go straight up into the mouth,
Straight up.
maybe the blade is not that long to go all the way into your brain tissue, but if you go backwards, you're now into the airway, messing with the airway even more. Could go deep enough to potentially sever the spinal cord if you can get through the vertebral bodies. Interesting. Takes the blade out and you see a big squirt of blood. Remember, every time I tell you, don't pull it out. Major blood vessels are on either side. He went right down the middle. The blood just pulled out, almost like releasing a valve. It's not continuously spraying. That could also mean that the heart's not beating anymore, so it's not flowing.
I'm sorry. Are we not allowed to leave?
You see that laceration? That's right here. Probably missed the major blood vessels on either side. You hit the vessel in front and then you might have hit into the airway. Close your neck down, put compression to the area, but not a ton, and get out of that situation. You're not gonna fall over. Human bites are so dirty. They're dirtier than like a dog bite. We always have to worry about covering somebody with antibiotics if you have a bite, because these are puncture wounds. So you're embedding bacteria in, really hard to clean out well enough to get the bacteria out. So we have to cover to make sure you don't get cellulitis.
We were just distracting you.
Ooh. Oy. Puncture wounds straight through the back into the heart. Not a survivable injury right here. It's literally right where your heart is. The heart is middle to the left. Once you pull these out, you're gonna have big holes. Blood's gonna flow out, and that's when you're going to pass quickly. Oh. Or you do that. Whoa. We all deal with high stress moments constantly, and that's exactly why I created Chillax by my company Life Happens, designed to help support relaxation, whether you're watching intense face-offs like this or just dealing with your own stressful week. Check out Chillax at lifehappens.com or on Amazon. This is why I don't like to go in the ocean. No, I'm just kidding. How did it actually come out the mouth? Did it go in through the backside of the neck out the mouth? You can see it's actually destroyed the tissues of the mouth. If somebody had trauma or injuries like this that comes to the hospital, you need to have major reconstructive surgery. You'll probably need to have some grafts put in and, unfortunately, dentures.
It's a Frenchie.
Oh, jeez. Punching people in the face increases the risk of metacarpal fractures. Your hand fracture also increases the risk of getting bad infection of your bones. So if you keep punching somebody in the face, especially in their teeth, bacteria in the mouth can actually get into your hand, get into your joints, and then you get septic joints. Ooh. Puncture wound through. Could this actually happen? Yes, potentially. Crowbars are quite heavy. It can go through the frontal bone. The frontal bone has the frontal sinus, so it's two thinner pieces of bone there because there's air in between. Oh, the strength of the individual is probably pretty great to be able to take this and pry open. You do see pieces of brain tissue. You see pieces of skull as well as the flap of skin. We do see this at the hospital occasionally when you have traumatic brain injuries, typically from car accidents, sometimes gunshot wounds. This wouldn't show up to the hospital. Somebody would be pronounced on scene after seeing this type of injury. The boys, this is crazy. These are some of the more almost like realistic but crazy injuries that I've seen in this show. If you guys enjoyed this and want to see more of The Boys, you let me know, or any other shows, definitely check out this playlist right here. Binge watch everything. Make sure you subscribe, turn on your bell notifications, and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.